This meeting will come to order. Today we have a hearing titled Premium Increases by Anthem Blue Cross in the Individual Health Insurance Market. Before we begin, I ask unanimous consent that the contents of our supplemental memo be entered into the record. This supplemental report is in regards to our investigation in the small business health insurance market. We had a draft last night. I think it was just finalized today. Okay, and the company documents with that memo, there's a document binder I think we've all agreed on. So without objections, they'll be entered into the record. I should also note for the record that members will be going back and forth, 2 floors up. Consumer Protection Trade Subcommittee is also having a hearing on telecommunications, which many of our members are members of both subcommittees, and they'll be going back and forth for this hearing. Right now, the chairman, the ranking member, and chairman emeritus will be recognized for a 5-minute opening statement. Other members of the subcommittee will be recognized for a 3-minute opening statement. I will begin. Today's hearing is the 5th hearing in this Congress that our subcommittee has examined questionable business practices in the private health insurance market. One of the hearings we had last year examined the problem of underinsurance. We heard stories about ordinary citizens who thought they had sufficient health insurance, but learned that their policies were inadequate when they needed them most. We also looked into the problem of small businesses purging, which is when a health insurance company raises premiums to the point it is unaffordable for businesses to continue their health coverage. Lastly, we held 2 hearings on rescissions, which is the private insurance industry practice of terminating coverage after a policyholder becomes sick so the company can avoid paying expensive and much-needed health care. Our hearing today will focus on rate increases in the individual insurance market in California. We will examine what is happening when insurance companies have no limitation or accountabilities on their rate increases. While most Americans receive health insurance through their employer in the group market or through government-assisted programs such as Medicare and Medicaid, more than 15 million Americans receive their health insurance through the private individual market. The individual health insurance market is unique in that companies are limited in their ability to spread the risk among a larger population. While today's hearing will focus on WellPoint's proposed premium increases in California, this is a national problem. According to a disturbing report released today by the Center for American Progress, WellPoint has implemented or proposed double-digit rate increases in 11 of the 14 states in which they operate. In Maine, WellPoint raised individual rates by 23% this year, after 5 straight years of double-digit increases for individual policyholders in that state. Likewise, Indiana residents covered by certain WellPoint policies will endure a rate increase of 21%. In Georgia, WellPoint policyholders face a 21% increase in 2009 and are anticipating a similar rate increase again this year. And in the West, Colorado expects average rate increases in WellPoint policies of nearly 20% and as high as 24.5% this year. But as residents of my home state know, the problem is not limited to WellPoint subscribers. Some Michigan policyholders are facing a proposed rate increase of 56% in the individual market. On January 26th this year, WellPoint sent out letters advising 800,000 California policyholders of possible rate increases for the coming year. As it turns out, nearly 700,000 WellPoint subscribers received rate increases of as much as 39%. WellPoint has tried to justify their rate increases through a high-profile media campaign, reassuring policyholders, congressional leaders, and the administration that the proposed rate increases are necessary due to rising medical costs and declining business resulting from economic difficulties, not from padding their bottom line. Through our investigation, we discovered internal documents that suggest a closer relationship between the proposed premium increases and WellPoint's profits. The documents reveal that WellPoint sought inflated premium increases as a negotiating tool with the California Department of Insurance. WellPoint also appears to be directing policyholders to less generous health insurance plans as a way to lower medical claims while awarding their executives excessive salaries and paying for lavish retreats. In our insurance rescission investigation last year, we learned that if an insurance company believes your illness may be costly, it will go back and re-examine your initial application to find an excuse to cancel your coverage. As health insurance industry executives brazenly told us, this practice will continue until there's national health care reform to expressly prohibit it. In this case here, we are reminded of this sad fact. An internal WellPoint document tells us that the practice of rescission is a, quote, key issue for maintaining lower medical loss ratios. Our first panel of witnesses will put a face on the frightening premium increases that have affected California. Lauren Meister received notice of WellPoint increase her rates by 38.6%. WellPoint offered her an alternative plan that does not cover the brand name medication she requires to treat a chronic condition. Julie Henriksen is a single mother with 2 children. WellPoint has proposed to raise her premiums from or by 30%. One of her 2 sons was born with a hole in his heart and required open heart surgery at age 3 and now requires annual care from a cardiologist. If Lauren switches to the alternative plan WellPoint has offered, she will have to pay $5,000 out of pocket before her insurance even kicks in. Jeremy Arnold has experienced rate increases on his WellPoint policy totaling 74% between 2009 and 2010. Anthem has proposed to increase his rates 38% this year. We'll also be hearing from Angela Braley, the president and CEO of WellPoint. Accompanying her is Cynthia Smith, WellPoint's executive vice president and chief actuarial. I look forward to their testimony to help this committee understand why WellPoint made the decision to raise premiums this year by up to 39%. Tomorrow, the White House will be holding a summit to discuss the president's newly released health care reform proposal. Included in this proposal is language granting states the authority to regulate rate increases by private health insurers like WellPoint. This hearing could not come at a better time. It provides a frightful reminder that unless Congress and the administration acts, Americans across the country will continue to experience large premium increases and will be priced out of the market. With limited or no health care coverage, we are all just one injury or illness away from bankruptcy. Next, I would yield to the gentleman from Texas, Mr. Burgess, and welcome him as sitting officially as the ranking member now of the Oversight and Investigations Committee. I look forward to working with him throughout this Congress. And Mr. Burgess, your opening statement, please.
Thank you, Mr. Chairman. We'll see if you still feel that way after a few months. Thank you and Chairman Waxman for allowing us to have this hearing today. I want to thank the witnesses who've traveled far and wide to come and be with the committee today and to share their stories, both the purchasers of health insurance and the people who provide health insurance. You know, it's odd, Mr. Chairman, though, you look around the room and you don't see the insurance commissioner of the state of California, which really strikes me as odd in a hearing of this nature. If the reason for this hearing is to determine whether a state insurance company has violated a state's regulations, then you would think logically that the head of the state's regulatory agency would be present and be with us. But here today we have Anthem, WellPoint's California subsidiary, in a dispute with the California Insurance Commissioner. The evidence shows that Anthem submitted, as required by California state requirements, their actuarial determinations as to why they needed to decrease premiums less than 20%, as well as raise some premiums as high as 39%. The evidence also shows that the California State Insurance Commissioner did nothing with the actuarial information they were given by Anthem. They did not raise a single complaint for over 4 months. Now, why the federal government is involved in a state issue, a state dispute, to me, presupposes that the fundamental difference between the line of thinking between national Democrats and national Republicans in the health care debate. The central argument of the Democratic Party is that we need a national, single federal regulator oversee all health insurance companies, but Republicans believe fundamentally that insurance is a state issue and based on risk pools, how many people get sick at one time versus how many healthy people there are who won't get sick. So the actuaries look at the marketplace and determine this ratio. And of course, we're involved right now in this tremendous, tumultuous health care debate, or what used to be called a health care debate before the president renamed it health insurance reform. And that's why the timing of this hearing couldn't be more coincidental. And just for the record, I never attribute anything to coincidence if it can be adequately explained by conspiracy. Tomorrow, the president is holding a bipartisan photo op on health insurance reform at the White House, a 6-hour photo op, so it's a significant photo op. And his Secretary of Health and Human Services has used the state-based issue, the increase of anthems in the state of California, to increase support as another reason why we need a $1 or $2 trillion health reform package. In fact, his Secretary of Health and Human Services has said that the profits of Anthem are outrageous, her words, and that the insurance companies should not make that much money. Why does profit matter if the actuaries have done their work? Well, I'll agree, a 39% premium is a huge number, a big scary number. But it may be irrelevant in this debate if the debate is on whether or not the business model of the insurance should be based on what the actuaries are determining as a risk spread. Now, I will make no apologies for the insurance companies. They're certainly capable of defending themselves, and if not, then they deserve what they get. But I think a GAO report needs to be commissioned to study how the insurance companies determine how much they are going to charge with their premiums. But if the numbers show that there will be a precipitous decline in the number of people who are in the risk pool, then any number, no matter how big, may in fact turn out to be acceptable. So if we're just focused on solving the dispute between California and Anthem, whose actuary is right? Now, wouldn't that be a scintillating hearing? We could have dueling actuaries. If Anthem is right, their actuary portrayed an accurate risk for the state of California, or is the California Department of Insurance right to complain 4 months after the fact that Anthem is a bad insurance company? But you know what? We're really not here to answer those questions. We're here to answer whether there needs to be reform in the healthcare industry as a whole. And I will tell you, as a practicing physician for over 25 years, there needs to be. Costs are a problem, yet after months and months of debate, we really haven't figured out how to answer the question, how do we bend the cost curve? Or actually, we figured out how to bend it in the wrong direction. We haven't determined whether these costs are conclusively attributable to the business practices of healthcare providers who are sometimes impugned, or the insurers who are often impugned, or whether these costs are attributable to what the First Lady is focusing on, lifestyle choices, diet, exercise, and the epidemic of obesity. Or maybe it's just because people are living longer and the costs of treating an older generation were never envisioned when we created Medicare back in the 60s. And of course, there's the advancing complexity of what we are able to do. The very fact that we have more than one cholesterol-lowering medication on the market is significant. What we can all agree on is there needs to be reforms in the health industry. Let's get rid of pre-existing conditions and lifetime caps. I'm for that. Let's work on tort reform. How about increased competition? I could be for that. Increased flexibility and portability? Who'd be against that? How about some improvements for people who are stuck in a COBRA system so that they're not stuck with such a high premium? I could be for that. But, you know, we're going to turn our attention to the President's Summit tomorrow. I hope the President is truly interested in including good ideas regardless from which side of the dais they emanate. I'll yield back the balance of my time.
Thank you, Mr. Burgess. Mr. Waxman, Chairman of the full committee, thanks for being here and look forward to your opening statement.
Well, Chairman Stupak, thank you for convening this important and timely hearing. On February 4th, the Los Angeles Times reported that Anthem Blue Cross, a subsidiary of WellPoint, intended to raise its rates as much as 39% for their 800,000 individual policyholders in California. And I want to single out Duke Health Fund and Lisa Girion, who are reporters who've done excellent work on this issue and brought to our attention the rescissions as well, which has been a tactic used by those who cover individuals for insurance policies. By any measure, this was a breathtaking increase in health insurance costs. We're holding today's hearing to find out what is really driving these enormous rate increases. WellPoint says the rate increases are a result of medical inflation and healthier policyholders dropping coverage. But the thousands of pages of WellPoint documents we have reviewed tell another story. They tell a story not about costs, but about profits, not about increasing coverage, but about reducing benefits to policyholders, not about removing barriers to coverage, but about erecting new ones, not about covering more people who have illnesses, but about cutting them off and seeking out new customers who are healthier and wealthier. The documents also tell a story of potential huge new premium rate increases still to come. WellPoint says that its rate increases have nothing to do with increasing company profits. But an internal company email says that its rate increase would, quote, return California to target profit of 7%, end quote. WellPoint says that its rate increases are absolutely necessary, but its internal company documents describe a plan to build in a cushion to allow for negotiations. The company told its board of directors that its average rate ask would be 25%, but that its final rate increase would only be 20%. Other documents raise the possibility that WellPoint may have manipulated its actuarial assumptions to keep its medical loss ratio, a key measure reviewed by California regulators, flat. The documents we have reviewed show WellPoint is proposing its highest increases on its more generous plans, and at the same time it is actively developing new products called downgrade options that reduce benefits for its policyholders. As we will hear from the witnesses on our first panel, this purging process cuts coverage for WellPoint policyholders when they need it the most, when they get sick. And the WellPoint documents point to a future of even higher rate increases. WellPoint told committee staff that WellPoint voluntarily capped its maximum rate increase at 39%. Well, if WellPoint had not done this, some policyholders could have faced rate increases of over 200%. Mr. Chairman, we've circulated a memorandum to members describing these documents, and I know they're now part of the record. One question we asked is, where does all of this money go? We have learned that in 2008, WellPoint paid 39 senior executives over $1 million cash each, and the company spent tens of millions of dollars more on expensive corporate retreats. During 2007 and 2008, WellPoint spent $27 million on 103 executive retreats. One retreat in Scottsdale, Arizona, cost over $3 million. Corporate executives at WellPoint are thriving, but its policyholders are paying the price. Ultimately, what this hearing will show is that the current system is absolutely unsustainable. If we fail to pass health reform, insurance rates will skyrocket, and health insurance will become so expensive only the most healthy and the most wealthy will be able to afford coverage. Health insurers like WellPoint may get richer, but our nation's health will suffer. We cannot go down this road forever. It is breaking our middle class, and it will bankrupt our nation. We'll learn much from today's hearing, Mr. Chairman, and I hope we'll apply these lessons when we meet at the White House tomorrow and in the days and weeks to come. We've got to reform the current health care system. Individual insurance seeks not to spread the costs, but to exclude people from coverage so that they will not cost the insurance companies more money. And that is not insurance that is going to protect people who need it the most when they get sick. Thank you, Mr. Chairman.
Thank you, Mr. Waxman. Mr. Gingrey for an opening statement, please, 3 minutes.
Thank you, Mr. Chairman. And Mr. Chairman, I want to join with you and all of our colleagues in welcoming and congratulating my OBGYN colleague on our side of the aisle as the new ranking member of the subcommittee, and I congratulate Dr. Burgess. First off, these patients here today, they need reform, as do many patients who find it increasingly hard to afford health insurance, or chronically ill patients who cannot find a policy because they are simply too sick to insure. The increases they received, especially in an economy like the one we're currently experiencing, are tough to justify, and I would like to thank them for coming today, and we look forward to your testimony. Throughout the past year, many in this Congress have seemed to operate in a bubble, seemingly oblivious to the needs or the wants of their constituents because of ideological reasons. We started this Congress with a hope that we would work together to reform our health care system. What we ended up finding was a Congress more prone to closing doors than opening them, creating special deals to, yes, buy Democratic votes instead of compromising to find Republican ones. I, along with many of my colleagues, continue to write the President and Democratic leadership offering my medical advice. Unfortunately, they have yet to respond. So whether it becomes a paycheck doesn't bring home enough money to afford it, or our sickest patients cannot access it, every American should have quality health care. A majority of Americans and an overwhelming majority of Congress strongly agree with that sentiment. Yet, here we sit without a health reform bill because Washington continues to pursue a bill that they cannot sell to the American people. The Obama plan is the same bill with a few minor changes, notably changes that favor unions, increased cuts to seniors' health plans. If it was a popular bill, we'd not be sitting here today. If it was a good bill, we would not be sitting here today. Mr. Chairman, the American people simply do not want the Obama plan. Every day that this administration and this Congress spends in backroom meetings on the Obama plan is one day too many. I believe I can speak for every member of this committee when I say that we can fix the problems in our health care system. The only thing standing in the way of that goal is a simple yet inconvenient truth. The plan President Obama and Democratic leaders want is not what the American people want. Mr. Chairman, I believe that the Democratic majority has a decision to make. If they truly want health care reform, they will need to get rid of the bill that Americans don't want. If they want bipartisan health reform, they will need to invite Republicans to work with them to help create legislation, not just to invite them to review what has already been created and now, of course, plussed up by another $100 billion. Inviting Republican leadership to a televised meeting at the Blair House while secret meetings on the Obama plan continue at the White House is not the change that the American people want or will accept. I look forward to the witnesses' testimony, and Mr. Chairman, I'll yield back as my time has expired.
Thank you, Mr. Gingrey. Ms. DeGette for opening statement, please. 3 minutes.
Mr. Chairman, I'll submit my opening statement for the record. What I want to say, I'm offended by some of the things that my colleague from Georgia just said. And the reason I'm offended by them, it's one thing for us to disagree about the content of a health care bill. It's another thing to disparage people's motives. Now, there are a lot of motives to be disparaged on both sides of the aisle. But I will say every single member of this committee who has worked on this bill, from Chairman Waxman to the ranking member to everybody else, has worked hard on this bill. Now, Mr. Gingrey and his colleagues may not like the bill that this committee passed, but they cannot deny that we spent hours of hearings in this committee and we spent hours of markups considering amendments from both sides. And if you don't like the bill, that's just fine. That's not a partisan problem. That's a problem of not liking the bill, and I understand that. But I would ask that Mr. Gingrey and everybody else just quit painting everybody with the same broad brush, because if we ever hope to restore a spirit of comity to this committee and this Congress, attacks like that should not be countenanced on either side of the aisle. I want to say one more thing. There really is a problem here that we're trying to deal with, and I don't think anybody in this room would disagree with that. As the chairman said, there are proposed rate increases by Anthem Blue Cross in California, in Michigan, in Connecticut, in Maine, in Oregon, in Rhode Island, and 20% in my home state of Colorado. Now, today on the floor, they're going to have a bill repealing the antitrust exemptions of the McCarran-Ferguson Act. Only 2 industries currently enjoy those exemptions, and that is the healthcare industry and Major League Baseball. I guess we can talk about Major League Baseball later this year. But if we want more competition, it would seem to me that this would be a good start, and I would hope my friends on both sides of the aisle would vote for this bill. In the meantime, though, to deny that there's a problem, to say, well, you know, the insurance companies, because medical costs are going up, have to increase their premiums like this is denying the fact that my constituents and everybody in this room's constituents cannot buy insurance policies on the individual market because they cannot afford to pay these rate increases. And I have people come to me every day and talk to me about this. Some of them are related to me, and I'm sure everybody in this room has experienced those same issues. So, you know, my view, and I've worked with Mr. Gingery, I've worked with everybody in this room. They know that I'm not particularly a partisan person, that I try to work on these issues in a bipartisan way. So I would say on both sides of the aisle, let's cut it out. If we don't like each other's bills, let's just debate against the bills. Let's stop disparaging their motives. And I yield back.
Mr. Chairman, since Mr. Jett mentioned my name, can I have 30 seconds to respond?
No, let's move on. We're not going to go back and forth. We'll have an opportunity later. Maybe Mr. Griffith can yield you some time, but yield now to Mr. Griffith for 3 minutes for an opening statement.
Thank you very, very much for the opportunity, and I certainly appreciate being here. The good news about health care reform is that everyone would like to see it happen. The discussion of how it might happen has certainly been ongoing and will continue to be ongoing. One of the bills that was passed this year that I think got not as much applause as it should have was the FDA's ability to control tobacco. Huge life-saving bill in and of itself. That in and of itself was health care reform, and I think Chairman Waxman needs to be proud of that, and I know as a cancer specialist I'm certainly proud of it. One quick comment is that in order to reform health care, we must understand we cannot reform it around a shortage, and the shortage are MDs. There's a difference between coverage and access. We have millions of Americans covered today who can't access health care because we don't have enough providers to take care of them. So if we gave everyone in America a little card that said USA Healthcare, our emergency rooms would still be just as busy as they are, just as crowded. We would still have just as much trouble getting our Medicare, Medicaid, and our pediatric patients seen. And so any part of reform or improvement in health care must include a major increase in the number of medical schools, a major increase in the number of children, showing my age, young men and women who are entering medical school, and we need to increase our mid-level providers, our nurse practitioners. We must increase their ability to see our chronically ill and do education. Half of all deaths in America over the next 100 years will be lifestyle related. There will be smoking, overeating, not enough exercise, unrelated to infection or malignant disease. Thank you, Mr. Chairman.
Thank you, Mr. Griffith, and I should say welcome to the committee. It's your first time with us. Welcome to the committee. Next is Mr. Braley for an opening statement.
Thank you, Mr. Chairman. Even though the focus of this hearing is on rate increases by Anthem Blue Cross, what we're really talking about is a problem that affects people all over this country, because it's not a new problem, and the point has been raised about health insurance reform versus health care reform. I've always stressed the need for comprehensive global health care reform, and we cannot afford as a country not to move forward with health care reform. Even though this hearing is focused on Anthem Blue Cross in the state of California, this very same issue is affecting my constituents and client in Iowa. Last week, Wellmark Blue Cross Blue Shield, the largest health insurer in Iowa, announced it would raise rates an average of 18% for Iowans who buy their own health insurance. And that's expected to affect about 80,000 Iowans. Some of them will see their rates go up over 20%. According to Wellmark, this is the largest annual increase since 2006, and the troubling rise in premiums comes on top of an average 9.3% increase for individual policyholders last year and a 54% increase in rates for individuals over the past 5 years. So when asked about this, the company spokesman noted that this was not related to anything that we don't already deal with, and blamed increase in chronic conditions such as obesity and knee and hip ailments, as well as the price of prescription drugs and high-tech medical imaging. And this is what's very fascinating. He also said the real way to make insurance more affordable is to lower health care costs and require everyone to have insurance, which is one of the very points that we have been struggling with in this debate over how we address the problem of providing access to health care coverage for millions of Americans. So I think Iowans want to know exactly why companies like Wellmark and WellPoint are raising rates on these individual plans and what factors went into their decisions, because everyone who's affected by this deserves a detailed justification for the increases from their insurance companies. They deserve to know that their elected officials are working to ensure appropriate and adequate oversight and regulation of the insurance industry and working to ensure that they have access to quality, affordable health care. That's why I believe this hearing is a good first start, but it's also one more example about why we need comprehensive health care reform in this country. All Americans deserve access to quality, affordable health care coverage as soon as possible, and unless we look at all the contributing factors, including unregulated high increases in health insurance premiums, which have been going on for decades in this country, we're never going to get at the root of the problem, and that's why I look forward to the testimony of our witnesses, and I yield back.
Thank you, Mr. Braley. Mr. Green for an opening statement, please.
Mr. Chairman, I want to thank you for holding this hearing today on the recent individual health insurance policy increases proposed by WellPoint and Anthem Blue Cross Blue Shield in California. Millions of Americans do not have insurance through their employers or through public programs, and they turn to the individual insurance market to purchase an insurance policy. Individuals who purchase insurance through the individual market must go through a sometimes difficult application process, and often they're denied coverage due to pre-existing conditions. Even if they're approved for coverage, they cannot afford the premiums in the individual market. We do know that in tough economic times like these, healthy individuals will drop their coverage to save money because health premiums across the board are too high. And because of this occurrence, could reduce these risk pools so significantly that extreme premium increases are necessary for those individuals who want to maintain their individual policies. At least that's the explanation given by WellPoint President and CEO Angela Braley to HHS Secretary Sebelius when asked to explain skyrocketing premium increases in California. There are not enough healthy people in Anthem Blue Cross Blue Shield California individual market, and 39% premium increase is necessary for Anthem to continue to provide individual market coverage in that area. The data emerges from the National Association of Insurance Commissioners clearly showing that enrollment in Anthem BCBS in California increased from 583,967 individual policies at the end of 2008 to 627,082 individual policies at the end of the third quarter of 2009. That's an increase of over 7% in the individual market for Anthem in California alone, so a high rate increase because of a reduced pool doesn't make sense. It appears to me that the insurance industry's dirty little secret, drastically increasing individual policy rates without justification and running roughshod over consumers, have finally been given the public attention it deserves. Our companies and Anthem Blue Cross Blue Shield has been trying to get away with these outrageous type increases in Michigan, Rhode Island, Washington, Connecticut, and Maine, just a few. Unfortunately, states like Texas have very little we can do to prevent these rate increases from going into effect, and we're often at the mercy of the insurance companies, and that is historically true in Texas. Today, we're finally telling the insurance industry that the party's over. You've been making astronomical profits in the individual market off the backs of the sick and working folks who do not have an option to obtain health insurance, but in the individual market. It's gone on too long. Both the House and Senate reform bills contain provisions to give states and HHS Secretary the ability to review health insurance premium increases, and the President's proposal to take this one step further by creating oversight of insurance premiums at the federal level. If individuals cannot afford health insurance, they end up in the emergency rooms, forcing the health care system and the taxpayer to pay for their expenses. Yet the insurance companies continue to see increased profits while making it nearly impossible for individuals to gain access or to afford a policy. These hearings will highlight what we desperately need insurance reform and health insurance reform in our country. All individuals should have access to quality and affordable health insurance. And, Mr. Chairman, we're not seeing that in our country. Otherwise, insurance reform wouldn't be needed. But we know in my particular district, 43% of my constituents who are working don't have insurance through their employer, so they don't have a group plan, so they have to go to the individual market, and so often they're priced out of it. Now, yield back my time.
Thank you, Mr. Mr. Markey for an opening statement.
Thank you, Mr. Chairman, very much. Many people think that health insurance reform doesn't matter to them because they already have health insurance. Skyrocketing premiums and insurance company abuses, however, reveal a different story. Medical bills are the leading cause of personal bankruptcies in the United States today. In 2009, 60% of all people who declared personal bankruptcy did so because of their medical bills, and 80% of those people actually had health insurance. They just weren't covered for what it was that ultimately came to become the disease that affected them or their family. People just discovered they weren't covered. It is appalling that over the coming weeks and months, when many Americans sit down to pay their bills, they will open a letter from their health insurance company informing them that their premiums will increase by 14, 22, or even 39%. Last week, I spoke with a small retail business owner named Diane Ottenizio from Woburn, Massachusetts, in my district. She recently got a letter from her insurance company saying that her health insurance premium is jumping by 32% from $494 per month to $652. And her husband had the same increase. So this is essentially a 30% increase. And she says to me, personally, my small business is struggling to survive, and I'm expected to pay an extra $158 for the same health plan. It's making an already difficult economic situation even worse. People like Mrs. Ottenizio are doing the right things and faithfully paying their health insurance premiums, but it's becoming increasingly difficult when some insurance companies are jacking up premiums and experiencing huge profits. In the midst of this economic crisis, WellPoint, the parent company of Anthem Blue Cross, recorded a $2.3 billion increase in annual profits. That's a 91% increase compared to the company profits in 2008. Did that jump in profits mean that WellPoint covered more of their customers' medical costs? No. In fact, their contribution to medical expenses of their customers decreased by 1%. Did this rise in profits lead to an appropriate reduction in premiums? No. Anthem Blue Cross is considering raising individual health insurance premiums by as much as 39%. And sadly, Anthem Blue Cross is not an isolated case. Last week, Health and Human Service Secretary Sebelius released a report showing that health insurance companies in 6 other states proposed outrageous increases in health insurance premiums. There could not be a more important hearing, Mr. Chairman. I thank you for having it. It goes right to the heart of the anxiety that millions of Americans all across our country are feeling right now as we sit here in this hearing room. Thank you.
Thank you, Mr. Markey. Ms. Christensen for an opening statement. 3 minutes, please.
Thank you, Mr. Chairman. Amid the reports of record-breaking profits in the insurance industry, almost 3 million more people in this country lost their coverage. So I want to thank you, Chairman Stupak and Ranking Member Burgess, for having this oversight hearing on what proposes to be an extreme increase in insurance premiums. This morning, we're looking at what is happening in California, but premium increases every year, year after year, are hurting American families and increasing the ranks of the uninsured, exactly the opposite direction this country ought to be moving in. Over the years, I've worked with WellPoint, and I applaud the work they've done in diversity and wellness programs and other areas, but I am alarmed by the proposed 39% increase in premiums. Despite the reasons they offer, I do not see that they support the need for these premium increases, and I cannot support them. WellPoint is among the big 5 who enjoyed a combined profit of $12.2 billion last year. I don't grudge them their profits. You're in the business to achieve profits, but ordinary folks, your clients and others, are having to make unsustainable sacrifices to keep health insurance and to make ends meet. I cannot see why keeping the premiums where they are, having been raised around 20% last year, would be an even comparable sacrifice for WellPoint or its shareholders, because as I see it, you would still realize substantial profits. We welcome WellPoint's support for health care reform. Indeed, in a very real way, this Congress's failure to pass meaningful legislation, such as we passed in this committee last year, is a major part of the problem we are discussing today. It's time for our Republican colleagues to stop blocking what we and the other committees passed after long hearings and markups in which everyone was involved. So anyone who goes to the White House tomorrow without a determination to ensure everyone to provide equitable health care to everyone, including those living in the territories, and reduce health care costs should get out of the way and let others who will do what has to be done sit in their chair. If there's anything that WellPoint and those of us on this side of the dais can agree on, is that we might not be here having this hearing today if the President had signed the kind of legislation this House passed last year. I want to welcome those who are here to testify this morning, both the customers of WellPoint and the officials from WellPoint, and I look forward to your testimony.
Thank you. Mr. Welch, for an opening statement. He stepped out away. He must have ran up one. Ms. Sutton, opening statement.
Thank you, Mr. Chairman. Thanks for holding this hearing today. I'd like to be able to say that I'm shocked that we're talking about this, but sadly I'm not. While I understand that this hearing focuses primarily on Anthem Blue Cross in the California market, unfortunately, as we've heard here, the situation is not unique. Across this country, millions of Americans, affecting both individuals and businesses, are being devastated by shocking increases in their health insurance premiums. And let's be clear, health insurance companies have been socking it to the American people and businesses for years. Healthcare for America Now recently released a report that found that in 2009, the health insurance industry had record profits. Let's just think about that. In 2009, a year when the average American family suffered unlike any year in recent history, health insurance companies still had record profits. And according to the report, the 5 biggest for-profit health insurance plans had combined profits of $12.2 billion in 2009, up 56% from the year before. According to a Health and Human Services report, over the last 9 years, profits at the largest insurance companies increased 10 times faster than inflation. And over the last decade, the amount private insurance companies spent on administrative costs, instead of paying claims and covering care, the amount that they spent on administrative costs grew faster than the amount they spent on prescription drugs as well. Premiums continue to skyrocket, but consumers don't receive additional benefits or care. These increased premiums mean families have to make untenable choices. They're forced to sit down and weigh their chances of getting cancer or getting hit by a bus against having to pay an insurance premium that is now suddenly 30% higher, sometimes higher than their mortgage. Choosing to pay the higher premium means they may not be able to pay their heating bill or other basic life necessities, or send their children to college. Or sometimes it means choosing, if you can even call it a choice, to not have health insurance. This is not a situation that should occur in the United States of America. And that is why we've heard a lot about health care reform. The Affordable Health Care for America Act that was passed by the House contained an 85% medical loss ratio, which would require insurance companies like Anthem Blue Cross, WellPoint, to be held accountable to consumers when they do not spend enough of their premium revenue on actual health benefits. The days of health insurance companies putting profits before people need to be over. I'm sad that we're sitting here to discuss this today, but the American people, they need answers. And it's time for WellPoint to explain why they are raising premiums in this way, especially right now. And I yield back.
Thank you. Mr. Welch is here.
Thank you very much.
Statement.
Thank you, Mr. Chairman. These premium increase requests really are just the latest effort on the part of the insurance industry to preserve and protect its business model. And it's a business model that served them extremely well with record profits and record salaries, but has imposed real harsh consequences on individuals in America and our businesses that are trying to provide health care to their citizens. It's not sustainable. I mean, there's nothing really to talk about. How possibly can a family or a business cope with an envelope that arrives telling them that the cost of health care is going to increase 40%? And Anthem, WellPoint always has an excuse, always has an explanation. That's, quote, the cost of health care. But essentially what the insurance industry has done, unfortunately with a good degree of success, is block any systemic reform which this country needs in order to have a health care system that's affordable and accessible. It's pretty astonishing when you look at what the premium increases has been. 26% between 2003 and 2008 for single policies, 33% for family policies. The 10 largest health insurers saw their profits balloon to from $2.4 billion in 2000 to $13 billion in 2007. And as the member from Ohio was saying, the amount paid to health providers has gone from 95% in some cases to 74%. That has enabled some companies to pay executive salaries in the range of $24 million. In my own small state of Vermont, when the CEO of Blue Cross left, he got a $7.2 million golden parachute. That came out of rate increases. It came out of businesses that were struggling with the decision about whether they were going to cut workers or cut their benefits, a decision our employers don't want to make. So if I have a complaint about the insurance industry, it's not the individual rate increases, it's the consistent effort to stand in the way of health care reform so that the folks in this country, the businesses in this country, can have some confidence that they're going to get affordable and accessible health care. Health care is not about being in service of the insurance industry. The insurance industry should be about being in the service of helping us have access to health care. I yield back. Thank you, Mr. Chairman.
Thank you, Mr. Welch. Last but not least, Mr. Schakowsky, opening statement, please.
Thank you, Mr. Chairman. When I saw the latest stories out of California about Anthem Blue Cross's decision to raise rates, I knew, my constituents knew, this is not an isolated incident. It's just the most recent example of what the insurance companies are doing to policyholders across the country. This committee has known for some time that arbitrary rate increases are a real threat to health access. Last summer, 12 of my colleagues and I successfully offered an amendment to the health reform bill to prevent excessive premium hikes like the one we now see from Anthem. We passed legislation requiring prior approval of large rate increases, and I'm glad the President has now called for strong rate review regulation in his proposal for comprehensive reform, and I look forward to ensuring that what started as an amendment in this committee becomes law. I've heard from my constituents in my district asking that we not limit our investigation to California or to Anthem. They have sent me policy statements and renewal notifications highlighting years of high premiums. They've described the tough choices they've had to make, agreeing to high deductibles in an effort to maintain coverage, and yet the increases keep coming and coming. Illinois, like 25 other states, does not require prior rate approval of premium increases, and there's no authority to reject or deny excessive rate increases. So my constituents are turning to me, to Congress, to act to protect them. In addition to those stories, I've heard cases from my district showing that these trends are not confined to the individual market. From a community health center in my district, in the process of renewing their Blue Cross Blue Shield group policy, they're looking at across-the-board double-digit premium hikes this year, and they're being forced to pay higher co-pays for things like emergency room visits or to see a specialist. Congress has taken repeated action to increase funding for community health centers. That money was intended to provide quality access to health care for our most vulnerable populations not to pay insurance company premium hikes. Families are forced to make extremely tough choices when faced with an unexpected 39% increase in their budget, and their personal stories only emphasize the need for comprehensive health reform that brings greater access and affordability to our health care system. I would like to close by thanking the witnesses for their participation in today's hearing and look forward to their testimony. I yield back.
Thank you. That concludes the opening statements from all members of the subcommittee. I should note, and I appreciate the fact that Ms. Eshu from California is here, and I'm sure when we get the questions, she'll probably have a question or two. And Ms. Capps was also here, who just had to step out. As I said, we have two hearings going, one on the third floor and one here, and members are going back and forth. But members of the full committee of the Energy and Commerce Committee who may not be a member of this subcommittee will be allowed to ask questions at a later time of witnesses. So that concludes the opening statement by members of the subcommittee. We have our first panel of witnesses before us. They are Lauren Meister, who's from West Hollywood, California, Ms. Julie Henriksen, who's from Los Angeles, California, and Mr. Jeremy Arnold, who's also from Los Angeles, California. It is the policy of this subcommittee to take all testimony under oath. Please be advised by the rules of the House that you are allowed to be advised by counsel during your testimony. Do you wish to be represented or advised by counsel during your testimony? Any of our witnesses? No, all shaking their heads no, so we'll take that as a no. Therefore, then I'm going to ask you to please rise and raise your right hand to take the oath. Do you swear or affirm the testimony you're about to give before this committee is the truth, the whole truth, nothing but the truth? Let the record reflect the witnesses have replied in the affirmative. They are now under oath, and they will begin with an opening statement. I would ask Mr. Arnold if you would not mind going first. Pull that mic up, press a button, a green light should go on, and you need to keep that mic fairly close to your voice in order to project your voice.
Okay.
If you begin, please.
Thank you. Good morning, Mr. Chairman, members of the committee. I am an Anthem Blue Cross policyholder who has been directly impacted by Anthem's astonishing proposed rate increases in California. Because I work as a self-employed writer and also have an additional part-time job, I have had to purchase individual health insurance. 2 weeks ago, Anthem informed me that the premiums on my Right Plan PPO 40 policy were going up 38%, from $231 to $319 a month. This follows an increase exactly 1 year ago of 26%, when my rates went up from $183 to $231 a month. In other words, my premiums are poised to rise to a level that is a whopping 74% higher than barely over a year ago. This is outrageous. My benefits have not improved in any way, and I don't go to the doctor that often. Last year, I went a handful of times and paid about $1,250 in medical bills. As per the terms of my policy, Anthem paid a balance of about $1,600 in claims, far below the $2,700 in premiums I paid Anthem. I did also take prescription drugs, including a generic and a brand name medication to manage high cholesterol and blood pressure related to a mild heart condition that I developed after I joined Anthem. Those 2009 drug costs were subject to a separate $500 brand name deductible. In its notice to me last month, Anthem offered to switch me to a plan with a lower increase in premiums, but one which does not include brand name drug coverage. That is unacceptable to me since I need that coverage to treat my condition. There are other Anthem plans I could try to switch to. Some of these require underwriting, in which case my pre-existing condition would probably make me ineligible. Some don't require underwriting, but carry high deductibles, lower lifetime maximums, and very poor prescription drug coverage. If Anthem goes ahead with its desired rate increase, I will not only be driven to one of these high deductible policies, I will have to hope that I don't get sick or injured. Hope is not an effective health care policy. And hope is not what Anthem is supposed to be selling. I eat right, I exercise, I take care of myself, I'm generally a healthy person, and I resent being squeezed in this way. Anthem tries to justify these rate hikes by citing rising medical costs. This is disingenuous. If insurance companies believe that medical costs are out of control, they should fight them rather than simply passing them off to ordinary Americans. Anthem and WellPoint's recent astronomical profits are repellent because they're at the expense of breaking the backs of people like me. I have no problem with corporate profit-making, but I do have a problem with profiteering, especially when it's at a level that penetrates so far into the economic and social well-being of our country that we Americans are discouraged from pursuing dreams and starting businesses and are stuck in undesired jobs simply because we worry about losing our health insurance or being able to afford it for our employees. This is wrong. It's insane, and it must be fixed by doing whatever it takes to pass meaningful health reform now. It would be simplistic to think that Anthem's corporate greed is the only problem here, though it is a huge one that I believe requires stringent regulation. Sharing the blame are indeed hospitals and doctors raising rates far above what is defensible, and a legislature that is too beholden to special interests and consumed with partisan rhetoric to take necessary action. All these parties feed off each other to conveniently and happily line their own pockets or win elections while blaming the other side and caring not a whit about the rest of us. In conclusion, I want to say to Anthem and the insurance companies, including WellPoint President Angela Brawley, to hospitals and medical providers, and to legislators on both sides of the aisle, I ask you all, in words that are as true today as they were in 1953 when Joseph Welch first said them, have you no sense of decency at long last? Have you left no sense of decency? Thank you.
Thank you, Mr. Arnold. Ms. Henriksen, your opening statement, please. You might want to pull that mic up closer. It really has to get close to your mouth, or otherwise we won't hear it.
Good morning, Chairman Stupak, Chairman Waxman, and members of the committee. I first would like to say that I am honored and more so extremely encouraged with the invitation to come before the subcommittee to present my real-life situation regarding the most recent premium rate increase of my Anthem Blue Cross individual health insurance policy. The newfound urgency and the spirit of determination with which these hearings are taking place give me a tremendous amount of hope that the issue of health care reform is going to remain an enormous focus of attention until a solution is found satisfactory to all. A little about myself and my particular case. I am 54 years old. I have 2 teenage sons, Keaton, who just turned 18 years old and is heading to college next year, and Britton, who is 16 years old and a junior in high school. I am self-employed as a consultant in the field of architecture and interior design, specializing in hotel design. I have worked continuously in this field for approximately 27 years now. I make fairly good money, and both my boys attend private school. I have held a Blue Cross individual family policy since owning my own small business. My current policy is called a PPO share plan designated with a $1,500 deductible. My monthly premium is $1,042 covering the 3 of us. Dated January 26th, I received a letter with a booklet attached stating that on March 1st of this year, my monthly premium would be raised to $1,352 for the same policy. This is an increase of $310 per month, or a 29.8% increase. Just to clarify, my current policy states that I must meet an annual $1,500 deductible for each 2 members of my family, which totals $3,000, and an annual out-of-pocket expense of $4,500 for each 2 members of my family, which totals $9,000, in addition to the yearly premium of $12,504 that I pay already. I have to tell you that we have never even met the deductible each year. All 3 of us are very, very lucky to be very healthy. But what is most concerning to me is that I am held captive in this policy since my younger son, Britton, was born with a heart condition. Not discovered until age 3, he was born with a small hole in his heart about the size of a dime between his right and left atrium. In addition, he has a condition called a cleft mitral valve, which means that the flap that opens and closes to allow blood to flow from the atrium to the rest of the body does not shut properly. Rather, it swings back into the atrium, and in so doing allows a small amount of blood to flow back into the heart with each beat. He had surgery when he was 3.5 years old, which repaired the hole in his heart. At the same time, the mitral valve was corrected to the extent that it is categorized as a mild leak. The flap of the valve needs to move back and forth so it can only be cinched so far to correct a leak. He is seen by a pediatric cardiologist once a year for an ultrasound and an echocardiogram just to make sure that the leak has not changed from mild to moderate or severe. He is extremely healthy and is in no way hindered with any symptoms or restrictions when it comes to sports exercise. In fact, he is on his school's tennis team and has played sports of all kinds all his life. The reason that I am held captive, so to speak, is because he has, in insurance terms, a pre-existing condition. Sadly, I am allowed the so-called privilege of staying with Anthem Blue Cross and paying exorbitantly unreasonable premium hikes each year until I can't pay them anymore. In the same written notice by Anthem, I was offered a downgrade to my policy to an annual $2,500 deductible for each member with a $5,000 annual out-of-pocket amount for each member at a cost of $1,089 per month, an additional increase of $47 to my current $1,042. I am allowed to downgrade until the term change in policy takes place and then involves the act of underwriting, which I do not want to happen. I should note here that if I were to accept this new monthly premium of $1,352, thereby retaining my same current policy, this amount would be shy just $92 of my monthly home mortgage payment, which I refinanced this past summer. What worries me most is, what will it be like for my son when he is 22 years of age and I am no longer able to claim him as a dependent on my taxes? Will he be excluded from any kind of policy because of this unforeseen heart condition when he was born? I must tell you that I have never written to any government officials or office before this, and though my letter, just another amongst many in the storm of shock and outcry about Anthem's premium increases, but I felt so compelled to do so for the very reasons stated above, and the fact that in this economically depressed environment, I find the act of Anthem Blue Cross raising premium costs to individual policyholders for such high amounts truly unconscionable. Not to make light of the situation, but if I were to send out a letter today in my industry stating that I was raising my hourly consultant rate by almost 30%, I would not be working. To conclude, I find that even with all the disagreements in Congress regarding the latest health care reform proposals, amazingly, I really still do have a positive outlook that our government officials can come up with a workable solution to the obvious and urgent need to change the direction of health care in this country. I thank you for the opportunity to be heard.
Thank you. Ms. Meister. Sorry.
Good morning, Lauren Meister, West Hollywood. Thank you for inviting me to speak today. I've been an individual plan member of Blue Cross of California, now Anthem, for over 17 years. I've always dealt with the company directly, not through an agent. Like many people, in 2008, my income dropped substantially. I was paying a $500 monthly premium for Anthem's PPO 500 plan. I called Anthem in December of 2008 to see what other less expensive plans were available. I expected the plan would have a higher deductible or copay, but would still have the basic necessary coverage. The Anthem rep was aware of my budget, my medical history, and age. I was turning 49. She recommended Anthem's PPO 1500 plan, which was about $1,000 less per year, so I switched. Just a few months later, I received a notice from James Oatman, VP and General Manager of Anthem Blue Cross Individual, that rates for the PPO 1500 plan were being increased in March of 2009, and that the new monthly premium would be $528, even higher than what I'd been paying for the PPO 500 plan, but with less coverage. I paid the new premium until I spoke with friends about their plans. In October, I called Anthem again and asked them how the PPO 40 plan with brand RX coverage differed from the PPO 1500 plan, which they had recommended to me in '08. I was told by this Anthem rep that the PPO 40 plan had a lower monthly premium, no deductible, and a higher copay, but the main difference was it did not cover maternity, which at 49 I probably didn't need anyway, so I switched plans again. At 49, I'd been paying for maternity coverage, a costly, unnecessary benefit. I thought Anthem execs should know, so I wrote a letter to James Oatman, and I copied Miss Angela Brawley, Ben Singer, Director of PR for Anthem Blue Cross of California, as well as Senator Boxer and Congressman Waxman. The only response I received was from Congressman Waxman. Excuse me. In January 2010, James Oatman finally did send me a letter, but this was to inform me that my rates were being raised once again, from $373 to $516 per month, an increase of 38%. The letter noted that I'd also have the option to change to PPO 40 plan with generic RX coverage only. This alternate plan would increase my premium by only 16%, as if a 16% increase was a great savings. I have allergy asthma, and I take brand prescriptions Accolade, Arabid, and Symbicort. Symbicort is fairly new. Accolade will not be generic until probably 2011. Hopefully, I can hold my breath until then, literally. For the record, with the proper medication, my breathing capacity is nearly 100%. But without the proper medication, I may end up needing more health care services, which ultimately will increase medical costs for both me and my provider. Pre-existing conditions, such as asthma, limit one's chances of being able to switch to a different health care provider, particularly if the goal is to lower the cost of the premium and still maintain coverage. This is only one of many reasons why we need health care reform. I read that Anthem's explanation for increasing rates by up to 39% was rising medical costs. In one respect, Anthem is right. It shouldn't cost $20 for a hospital to administer an aspirin. But then Anthem's executive salaries and stockholders do not appear to be suffering. And how much money goes to lobbyists trying to prevent health care reform, the same reform that Anthem indicates is necessary to keep health care costs from rising? My issue with Anthem is shared by many and is just a symptom of a broken system. We have a system where prevention and wellness are not encouraged nor embraced. For example, because I was turning 50, my doctor prescribed a bone density test for a baseline measurement. Anthem Blue Cross did not cover one nickel of that test, even though that test could determine if I had a propensity for osteoporosis. Penny wise, pound foolish. It's obvious the healthcare industry needs to be regulated. We saw what deregulation did to the cost of utilities in California. We saw what the lack of regulation has done on a global level to our financial and banking systems. Well, it's having the same effect on our healthcare system. If the city of West Hollywood, where I live, can regulate how much landlords can raise the rent each year to keep rents stabilized, why can't the federal government regulate how much insurance companies can raise their rates per year in order to stabilize premiums? I believe that we should all be able to buy health care coverage. If someone can afford to pay for private insurance, great. But if not, there's got to be a public, not-for-profit alternative without having to move to Canada, England, or France. Some representatives from Congress have stated that we don't need a public option. I say to them, I just want what you have, nothing more and nothing less. To me, insurance is like marriage. You expect the insurer to be with you in sickness and in health. That's why we buy insurance. If the insurer can't live up to this expectation, then perhaps they need to get out of the business of insuring. I also want to just reply that I'm an American and I support Obama's health plan. And I just wanted to make that clear. Thank you.
Thank you, and thank you all for your testimony and for coming here today. We're going to start with questions. We'll start with the chairman of the full committee, Mr. Waxman, for questions, please.
Thank you very much. I appreciate the testimony each of you has given. Ms. Meister, you indicated you're a constituent. I don't know if the other two witnesses are also constituents because you're from L.A. I do know that WellPoint is a constituent of mine as well. And I want to do what's right for all my constituents. But it's not right to have insurance companies deal with ever-increasing costs by shifting those costs onto the beneficiaries of their customers, because that's what they're doing. If you have a brand name drug, they won't cover it. You have to pay for it if you want it. If you want insurance, they figure out a way to increase your rates to keep the policy you already have. This is the problem with individual insurance. What we have as federal employees is that we can choose between a number of different plans, and they can't turn us down. And they can't charge us more if we have pre-existing medical conditions. We get coverage because the costs are spread among all the insured. That's true of federal employees, members of Congress, for a lot of people that work for large employers that provide coverage. But the three of you are not in that situation. You have your own business, you have part-time jobs, you have your own activities, so you have to go in the individual market. Those are the people, for the most part, who don't have insurance coverage because they can't afford it. And it looks like you may not have insurance coverage yourselves if you don't pay these increased rates, or they give you another alternative. WellPoint lets you go into another plan that costs more and covers less. What a deal. It doesn't hold down the costs of care. It simply makes you have to pay more of it. But that's not what you want from insurance. You want insurance to cover at least their share of the costs, and you would also like them to negotiate better prices to hold down health care costs overall. I don't see any evidence of holding down costs except shifting them on to you. Let's look at this situation that you're facing. Ms. Meister, you talk about your current plan. You have a PPO. You have to pay a percentage of your medical costs, and you you use a brand name drug as well as generic medications after you meet your deductible. Is that a correct statement of the plan you have generally?
Yes, and the brand drugs they don't come in generic.
So you can't get a generic for those where you need the brand name drugs. You told us in your opening statement you take your medication to treat chronic asthma. These are not in generic form. So if you go along with what you're being told by Anthem, you'd have to switch to a plan with inferior coverage or attempt to pay the higher monthly premium. That's where they've got you in the squeeze, isn't it?
That is correct.
Have you decided what you're going to do?
I've decided that I'm going to take the lower coverage with the generic brand, and I'll pay out of pocket for the brand medication.
And Mr. Arnold, you have the same health insurance plan as Ms. Meister, and they propose to increase your costs by 38% as well, or you could switch to a plan that covers generic medications only. Is that right?
That's correct. Or I could switch to a plan that also covers brand name, but one that has a much higher deductible overall.
And faced with this kind of a problem, you've got a terrible choice to make. Have you decided what choice you're going to make?
At the moment, I'm in a wait-and-see attitude because I know that these proposed increases have been put on hold until May 1st. But if nothing changes, I'll probably switch to one of the very high deductible policies.
Yeah. And they'd be very happy because that's what they'd like you to do. Then you just have to pay more of your costs. Mr. Chairman, these witnesses make clear that the alternative plans Anthem is offering to its policyholders provide dramatically less coverage for marginally less money. And if the only option available to consumers in the individual market is to pay outrageous monthly premiums or switch to a plan that doesn't meet their needs, then it's another example of why we need reforms in the individual market. All of us here will say we care about this. We want to have insurance reforms. That's what we're told. But you can't reform the insurance system without providing some standard policy so you can compare policies. You have such arbitrariness in the kinds of policies that you have available to you. And you can't really figure out what your needs are because from year to year it changes and it goes up. What we need is for insurance companies to have to provide insurance for everybody and spread those costs. And to do that, we have to make sure that everybody's covered. And to make sure that everybody's covered, we have to help people who can't afford their coverage. And we have to tell the insurance companies they can't deny you that coverage. That's where we find our differences as we try to deal with health reform. We've got to deal with the problem in a broader way then say, oh, let's do away with pre-existing conditions. Well, the Republican proposal doesn't even do that. They would put people with pre-existing conditions in a special group where they pay higher premiums, and they would be treated differently. We've got to standardize insurance and make sure that people have access to it. That's what President Obama has been trying to do. We're going to go to a summit tomorrow that the President has called for the Democrats and Republicans. I hope we can work on this on a bipartisan basis. This shouldn't be a Democratic or Republican issue. But we'll see tomorrow whether we can look for common ground rather than hear the accusations back and forth that we want to socialize medicine, or we're going to create death panels, or we're cutting back on people, the elderly, and then yet we find the lack of cooperation to find a solution to this intractable problem. I hope we don't let another opportunity go by and wait another 15 years before we tackle the problem again. You can't afford it, and the American people can't afford it either. Thank you, Mr. Chairman.
Thank you, Mr. Chairman. Mr. Burgess for questions, please. 5 minutes.
Thank you, Mr. Chairman. In the interest of bipartisanship and comity, I feel that I need to respond to some of the lectures that we've been getting this morning. Mr. Chairman, and I'm referring to Mr. Waxman as the chairman of the full committee, sir, I would be offended as the chairman of the committee if the committee passes a bill and the Senate passes, and it's a bill I didn't like, but fair enough, the Senate passes a bill I didn't like, was starkly different from this committee's bill, but nevertheless, they did what they intended to do. And then the proper process is for the two sides to get together, House and Senate I'm talking about, not Republicans and Democrats, but the House and Senate to get together and reconcile the differences in what's called a conference report, and this is part of our normal procedure. But now we have a situation where the White House functioned as the conference with no input that I'm aware of from yourself or Mr. Stupak or Mr. Rangel or Mr. Miller, the chairman of the Education Workforce Committee. The White House put together this conference report, and now we will be required at some point to vote on that and deal with it through a process called reconciliation, which is a little arcane, but it means you don't have to have quite so many supporters to get this done. And if the American people were behind what we were doing, it wouldn't be this difficult. Now, you can look at polls however you want, but 60% of the American people don't like what we're doing. 20% of the people are in favor of Congress generally, and 45% of the people are in favor of the president. So with these sorts of numbers, it is difficult to do something this massive in the form of restructuring. Now, just another issue that you brought up the Federal Employee Health Benefits Plan. It is an employer-sponsored insurance, so it doesn't exactly translate to what we're talking about here today. But had we worked more on making the individual market look more like the ERISA-protected market under employee-sponsored insurance, the multi-state corporations that provide insurance to their employees across the country that aren't so beholden to things like state lines, perhaps we could have delivered something that was meaningful for someone in the individual market. I've been in the individual market. I know that it's sometimes tough to find the plan you want. I've had adult children in the individual market. I've had to keep up with things that they chose not to, but I thought was important. We do have regulation in the individual market. It occurs at the state level right now. That may be a bad thing. Maybe it needs to be at the national level, but when I just look through the Federal Employee Health Benefits Plan book, I get a better deal because my residence is in Texas than I would in California, and certainly a better deal than I would get in New Jersey. So maybe I don't want a national regulator who's going to base everything on an area that is really not germane to where I live. So we do have to be sensitive to the fact that the states are different. Now, we passed a bill twice in the 108th and 109th Congress that would have allowed aggregations of small businesses across state lines, so-called association health plans, that would have given. The reason there's not pre-existing conditions in the Federal Employee Health Benefits Plan is not because we set up something that's better for ourselves. It's because the pool is so big. There's so many federal employees, which may be a good thing or a bad thing. We could argue about that, but there are so many federal employees that the pool is so large that pre-existing conditions actually don't enter into the equation. What we could do for writers across the country, for example, or architects across the country. Let every architect buy into an association plan where all the other architects buy into it, realtors, whatever kind of association you want to make, and suddenly you've got a pool that has the market share of a company like Verizon that sells in all, has employees in all states of the union and buys insurance for them. Mr. Arnold, I think you brought up about the affordability of the premium, and have you? And I don't know your income, and I'm not going to ask you, but have you looked at the House-passed bill and calculated what your premium would be?
No.
The House-passed bill, and I'm not lecturing you here, I want to make you aware, the House-passed bill is a good deal for someone who is unemployed and has no insurance. It provides access that has never existed in the past. Your premium under the House-passed bill, and again, I don't know how much you make, and I'm not going to ask you to tell us, but for someone who makes at 350% of the federal poverty level, the annual premium, I misplaced it. The annual premium would be right at $4,200 a year. So a little bit more than what you're paying right now. Now, 350% of the federal poverty level is a good salary. I don't know how it works out with California cost of living, but it's just a little under $38,000 a year for a single individual. I don't know whether you're married or not. Now, again, I'm not going to ask you. But just to point out that, yes, you've brought up a significant point that we need to pay attention to, that your premium has increased significantly under Anthem, and we are going to ask Anthem to justify what they have done in the California market. But I do want you to understand, with the House-passed bill, that not everyone in your situation, depending upon income, someone who earns it for 400% of the federal poverty level, which is $43,000 a year, would be paying $5,400 in annual premium as a single individual in the government option in the House-passed plan. Only 2 rating bands for younger and older, no tobacco ratings. So there are some things in the House-passed bill that might not improve affordability in your situation, and that's really what we're talking about here, because Anthem has affected the affordability of your policy. I'd give anything to know, Ms. Meister, what you were going to be charged for your bone density. I won't ask you, but I will also suggest that I think your doctor was right to recommend it, and if your doctor recommended it when you were 65 years of age, yes, it would be covered under Medicare, but your doctor would only be paid $40 for the privilege of providing you that service. Again, I don't know what your doctor was proposing to charge you. I suspect it was more than $40, but I don't know that. After you turn 65, under the big public option that we now call Medicare, if your doctor charged you more than $40 for that procedure, if he said, my cost is $200, and that's what I've got to charge you,
expired.
Your doctor would be violating the law to charge you the additional. So we'll give up some things if we go with the House-passed bill. That's why it's so important for us to get it right. That's why it's so important for us to go through regular order, not let the White House subsume the duties of the conference
Gentleman's
committee,
time has expired.
Unfortunately, what has happened now. I told you you'd regret having me here.
No,
I'll
Mike,
back my time.
I've sat in this chair a long time, and I've listened to you forever. And I know you always go over. I know I have to be diligent. I know I have to keep on you. I feel sorry for these witnesses because they're self-employed. They took time off of their jobs, probably at a loss of money, to come and give us the courtesy of asking them questions. You never asked them a question. So I feel sorry for our witnesses who had to take time off.
Valuable information they couldn't have gotten any other place.
Yeah, well, it's amazing. Let me just, it's my turn for questions. Let me just say a couple things. This committee, this subcommittee, the last 3 years have held hearings on underinsured, on rescissions, on purging of small businesses. And I asked for this hearing because, as I said in my opening, Michigan proposed a 56% rate increase. And I would have liked to have this hearing in L.A. We've had hearings in Indiana. I'll go anywhere in the country to hold hearings on health care because I think the consumers in this country are being bankrupt by health insurance. and I want to see health insurance pass. And the reason for this hearing, and it is a coincidence, when we set this hearing, when we were doing things, we didn't know the White House was going to do a summit on health insurance. But I'll go anywhere with this subcommittee. I'll go to any district and hold these hearings because I think they're valuable. And when Michigan proposed a 56% increase for our people, I have the emails that go from anywhere from finally settled at 30 to 39% increase for these small business people, much like the panel we have here today. And people just can't afford it. We are all truly one injury or one illness away from bankruptcy. But let me ask this question. Yesterday we did a hearing on Toyota, and 10 years ago, if I would have bought a car, and I buy one now today, I get all kinds of extra bells and whistles, whether it's a Toyota, a General Motors, wherever it might be. Mr. Arnold, Ms. Henriksen, Ms. Meister, has your insurance given you more bells and whistles as you've seen these increases? Mr. Arnold, yours went up 74% in the last 2 years. Ms. Henriksen, I see a premiums increase about, by the time you do your premium, your deductible, and you're out of pocket, that's about $31,000 before you even start tapping into anything. And Ms. Meister, you just trying to keep your drugs that will keep you breathing. Have you seen increases in benefits as these prices have gone up?
No, less benefits.
Yes, also less for me. Last year, in fact, when my rates were raised 26%, Anthem also increased my prescription drug copay for both brand name and generic.
Okay. Ms. Henriksen.
No, I haven't. And sometimes when I open my statement from them after going to a doctor or something, I'm shocked that, like, oh, wow, they didn't cover that. You know, it's things like that, but I haven't calculated exactly any changes.
You mentioned your son that had the heart issue there with the hole in the heart. Is there any length of your insurance, how long will they continue to hold this like a pre-existing condition? Like you mentioned, he's going to turn 22.
The rest of life.
Okay, so there's
he will always have a heart condition.
Which is, so thus far, required him to see a cardiologist. He doesn't
he's
yearly
fine.
problems. He's playing sports. And
yeah, he's completely fine. I mean, I you know, like I explained, there's
right.
You can only cinch it so far.
Right.
And it can't be completely corrected, so he will always have a condition in his heart.
Okay.
But he can only stay on my insurance till I claim him as a dependent.
Well, the other thing in looking at this file in WellPoint and Anthem here in California, and we're looking at one of the emails, the vice president for individual pricing states, he says, Jim has asked Brian to price 5 or 6 downgrade options to be made available in conjunction with the upcoming rate action, meaning this increase they're passing on. In another email, the company's regional vice president and actuarial, Brian Curley, proposes that WellPoint create 5 or 6 California look-alike plans for California with a benefit or 2 removed to create a downgrade option upon renewal. My question, and I guess I'll direct it to Ms. Meister, how does it make you feel to know that part of Anthem's business plan is to reduce or restrict your health care coverage being offered to you on downgrade options to switch it during your annual renewal? How are you going to be afford your medication?
I mean, this is what's been happening the last few years. I've had to downgrade because the price has gotten too high. So I will have to pay for my medications through my savings, through
what do you think that cost is going to be for your brand name drug if you're going to go to the generic? So what will the out-of-pocket cost be? Do you know of these drugs?
Yes, Accolade is $100, and I have to buy that every month. So that's
$100 for a 30-day
that's just
supply.
For the Accolade.
Okay.
Yeah.
All right, Ms. Henriksen, Anthem, I believe you said offered to switch you to a similar plan to the one you have now, which would come with higher deductibles. What's your opinion on the scale backs?
Pardon me?
What's your opinion on, well, okay, I can get a different plan, I'm going to get less coverage, but I'm going to have to pay more?
I figure I don't have a choice. I can't afford the premium that they are stating for the existing policy that I have now. So I have a call into my agent, and you know he's going to go over options for me, but I know from talking to him almost a year ago that because of my son's heart condition, I can only downgrade so far until he has to be underwritten, and I don't want to do that.
Okay.
So I would probably go with the the downgrade of the $2,500 deductible and the $5,000 out of pocket. You know, because it is $47 more than my existing payment, but it's not $310.
What's the breaking point when you can no longer afford it at all?
Oh, I think it's insane as it is now.
Because you said it was almost as high as your mortgage, right?
Yes, it's $92 less than my mortgage payment.
Mr. Arnold, let me just finish up with you, if I may. I know you've had a 74% increase in your premium rates, according to your testimony. Obviously, your insurance hasn't gotten better. Do you believe Anthem's trying to push customers off to plans with less comprehensive coverage and into plans that barely meets their needs, so they just drop coverage altogether?
Yeah, I mean, I think the reason that plans are going up are because healthy people are dropping it altogether because they're like me. They're getting priced out of it. I mean, I'm generally a healthy person. I have an existing condition, but it's getting so high that, I mean, if it went up to $800 a month, I'd have to drop it. That I couldn't afford, no way. But that's an extreme for just to prove the point. I mean, $319 a month, which they want to raise it to, is very, very difficult for me. The $231 that I've had for the last year, I've not been happy with, but you know, I've managed to do it, even though last year was a pretty tough year in this economy, and my income was lower last year than it was the year before. So, yeah, they are trying to push people like me out.
My time has expired. Thank you all for being here. Mr. Gingrey, questions, please.
Mr. Chairman, excuse me, Mr. Chairman, thank you, and I'll be fairly brief. And I wanted to direct my first question to Mrs. Meister. Ms. Meister, you mentioned in your testimony, kind of in your closing, that you want just what members of Congress, members of the House and the Senate have, nothing more, nothing less. And I want to just say to you and to the other witnesses that I agree with you. I agree with you. I think that the American people in every state should have that opportunity. And when the health care reform bill was first marked up in this committee, H.R. 3200, we spent hours and several days, in fact, several weeks, marking up that bill and amending it and making some suggestions for amendments on both sides of the aisle. And one, in fact, two amendments that I had in particular that I think you'll like, and I'd like to ask your opinion on it, was that all Americans have what we have, members of Congress. And that amendment, unfortunately, went down pretty much straight party line. And I followed up with that and said, well, you know, if there is a public option, and I think you in your testimony talked about a public option. As you know, right now there is no public option in any of the bills. But in this committee there was. H.R. 3200, there was a robust public option, as I'm sure you know. And so my amendment was, well, okay, if the public option is so good, maybe it is, then let's show good faith in it and have every member of Congress, House, Senate, and indeed the President and the administration and their families sign up for the public option. And that also failed on straight party line vote. I'd like to know your opinion and maybe the other members of the panel what they think of that. Well, those two recommendations.
I mean, I am very willing to pay for insurance. I just want to pay something that's affordable and that actually covers me. We have Medicare. I thought the plan that extended Medicare to 55, down to 55, was a good idea, and have those people between 55 and 64 pay for the plan. So I don't know what else to say. I don't want to have to be spending the next 15 years of my life looking forward to being 65 so I can get Medicare.
Well, yes, I mean, and certainly I understand your point there. But do you realize that, and I'm sure you do, that Medicare currently has an unfunded liability over the next 50 years of $35 trillion. That's with a T, $35 trillion, and so to add that many more millions of people between age 55 and 64, when we can't even meet the obligations that we currently have. You know, that was the problem with that proposal.
I've seen the country support a bailout for the banks and for the car companies. I'd like to see them bail out the American people.
Yeah, I want to tell you, and I think you'll be pleased to know that I voted against that bailout for the car companies, and I thank you for bringing that up. Mr. Arnold, let me shift to you just a minute. In regard to meaningful health reform, you mentioned that. By meaningful health reform, would you include in that medical liability reform?
Absolutely, I would. I think that ideas on both sides of the aisle, there are good ideas on both sides. Just to address what you just said a moment ago about the public option and so forth, the reason that, well, you explicated the reason. You said it was a party line vote. It's politics. The party that's not currently in power doesn't want to give the party that currently is in power and the president a victory of any sort. So partisan politicians and partisan media...
Well, Mr. Arnold, reclaim my time because I've just got a very few seconds left. Absolutely, I think that we ought to give the president the opportunity to do it in a bipartisan way, and that's why when we have this meeting tomorrow at the Blair House, the Health Care Summit, I feel sure that the members on the Republican side from the House and the Senate, maybe Dr. Coburn or Dr. Brasso, representing health care in particular as a profession, will offer that, and I look forward to the president hopefully adopting it because California, as the three of you well know, enacted that legislation back in the late 70s. I think the acronym was MICRA, and it's worked. It has worked, and fortunately the California legislature hasn't ruled any of that unconstitutional, so I'm glad that you support medical liability reform. Mr. Chairman, I see my time has expired, and I'll yield back.
Mr. Arnold, did you want to finish an answer there?
Yes, I would like a brief moment to finish what I was saying. I would, I thank Mr. Gingrey for what he said, and I take him at his word, and I would hope that you would encourage all of your partisan colleagues to operate in good faith and not to use irresponsibly words like socialism and death panels and so on and so forth that you hear from partisan politicians and from partisan media commentators because they are completely not an accurate description of the issues that are at stake. Thank you.
Ms. DeGette for questions.
Thank you. Thank you, Mr. Arnold, for clarifying your statement. I think what you said is important, and I hope everybody listens to it. It seems to me, in listening to all three of your testimony, aside from the fact that you're buying insurance on the individual market, the other problem that each of you has is either yourselves or family member with a pre-existing condition that pretty much limits you from trying to shop around and buy cheaper insurance. Is that correct, Mr. Arnold?
Yes.
Ms. Henriksen, Ms. Meister? And I understand, Ms. Henriksen, when you were talking, I told my staff, I said, I feel like this is me because I'm like you. I have two daughters, 20 and 16, and like you, my younger daughter has a pre-existing condition which she'll have for her whole life. Not only does that limit, even though I am in the federal employees insurance system, I'm still limited in shopping around because of underwriting. But what I'm the most terrified about with her is when she graduates from college and starts trying to buy insurance on her own, she's going to have an impossible time buying a policy, especially as a young person who's just starting out in the labor market, that will cover her pre-existing condition. I'm sure you've thought about that, too, with your son.
Oh, that scares me immensely. And with businesses eliminating all insurance group plans and things like that, I mean, in my industry, hardly anybody has it. There's a lot of consultants that I don't see how he's going to be able to pay for an individual policy with a pre-existing condition when he's working.
Right. Now, here's my question for all three of you. If you could go on some kind of insurance exchange that allowed anybody to go in and buy from different insurance companies, and the people on that exchange, so you could choose between competition between different insurance companies, and they couldn't exclude you or your kids because of a pre-existing condition, do you think that would help you with your insurance choices? Mr. Arnold?
It sounds like it might, yes.
Ms. Henriksen?
Yes, I believe that it's free enterprise, I guess, and you are allowed the privilege of shopping for almost anything else. Why shouldn't it be insurance, too?
Ms. Meister?
Yeah, because we're being penalized for being individuals and having individual plans.
Right. And you know, Ms. Meister, I want to ask you about something, because you said you thought it was a good idea if they extended Medicare down to age 55, and with every passing year, that idea sounds better to me too. But were you aware that those proposals didn't just say we're going to pay for people to have Medicare? They'd actually have to buy in.
Oh yeah, absolutely.
Right, and
I'm
you'd be
very
willing
happy
to
buy.
you'd be willing to buy into Medicare,
Yes.
is what you're saying. I just wanted to
Absolutely.
clarify that. Okay, now I just want to explore one more thing with the three of you, because I think there's been some miscommunication about insurance companies selling insurance across state lines. Were you aware that right now insurance companies can sell insurance across state lines, but if they do that, they have to comply with the laws of the state where they're selling that? Mr. Arnold, were you aware of that?
No, actually I wasn't.
Okay. Ms. Henriksen?
No, I wasn't either.
Ms. Meister?
No.
Okay. Well, see, what happens right now, different states like California or Colorado or Iowa or Georgia, any of the states, they can sell insurance across state lines, but if they do that, they have to give people the insurance coverage that those states require. So like if California says you have to cover maternity benefits, or you have to cover prostate cancer screening or something else, then they have to do that. But what the proposal that some from the other side of the aisle have made is to say people could sell insurance across state lines, but they would only have to comply with the laws of the state that where they're incorporated. It'd be sort of like, you know, how all corporations, not all, but a lot of corporations incorporate in Delaware, because those state laws are very favorable to corporations. So they could incorporate in a state which had very low requirements for coverage. And I want to talk to you about that, Ms. Henderson, because you've got 2 kids. Would it help you to be able to buy a very low-cost plan, but one that didn't offer very many coverages for you, like mammography or some screenings for your kid? Would that help you?
I guess I'd have to see specifically what they were
What it
offering.
was, yeah.
But like I said, we are so lucky to all 3 of us be healthy. We never go to the doctor. We have very little costs incurred, you know, through insurance. So it would be interesting to see what I could eliminate and what I would then need. I could pick and choose, I guess.
Yeah, you could pick and choose, but you wouldn't want to buy a plan that would barely cover anything if you got sick.
No.
And Ms. Meister, would you want to buy a plan that wouldn't cover the specific medications that you needed?
I'd have to work it out and see, you know, actually figure out the financial side of it and see how much my medications cost me per year and how much I'm being covered. I mean, even now I have a deductible for the brand. I believe it's $500.
Yeah.
So until that kicks in, it's 4 months into the year.
Yeah. Okay. Thank you.
Thank you. Mr. Braley for questions. We'll wait for Mr. Green to get settled there.
Thank you, Mr. Chairman. I began my opening remarks by talking about the fact that I'm not a Democrat who limits my conversation to health insurance reform, because I believe that health insurance reform is a key part of comprehensive health care reform. And I'm so glad the 3 of you are here today, because you help put a human face on what's wrong with health care and health insurance delivery in this country right now. I did 17 town hall meetings back in my district last summer, and what I learned is that people who oppose health care reform, and especially the health care reform we've been talking about, really don't want to talk about the human face of health care. So I want to spend a few moments talking to you about that. One of the people who came up to me in my last town hall meeting ripped the House health care bill and then said, after the meeting, "Congressman, I need your help." I said, "What can I do?" He said, "My brother was just diagnosed with non-Hodgkin's lymphoma, and he lives in the northern part of your district. The closest place for him to get treatment is at the Mayo Clinic in Rochester, Minnesota. But he can't get treatment there because they're not in his insurance plan's provider network." Another young woman interviewed me during the healthcare debate who was a classmate of my two sons, sat down to interview me, and the first thing I noticed about her was she had a cleft palate. And during her interview, she told me that she was so excited because her parents had almost saved up enough money for her last surgery. And I looked at her and I said, "Isn't that covered by your insurance policy?" And she said, "No. It's defined as cosmetic surgery under my plan." So a woman 21 years old, born with a birth defect, just like cystic fibrosis or cerebral palsy, which are covered under health care policies, has gone 21 years with a birth defect that limits her ability to eat, to talk, and most importantly, her self-esteem. The last one I want to talk about is my nephew's son, Tucker Wright, who I've talked about before in these hearings. Tucker was 18 months old when he was diagnosed with liver cancer, had 2/3 of his liver removed, has had enormous medical costs, and thank God he's still alive. But he will almost certainly reach his lifetime cap under his private health policy by the time he's 18. He will almost certainly have another bout of cancer before he turns 18. His parents are doing fundraisers to cover their uninsured medical costs. Both of them work full-time and have good health insurance. And yet if his parents want to change jobs, they would not be able to because of the exclusion for pre-existing conditions. All three of you have lived this in your own lives. So I want to ask you, Ms. Meister, you have chronic asthma. You talked about that. If you opted to terminate your policy with Anthem and purchase an individual insurance policy to get a more reasonable deductible or premium, you would have to go additional medical underwriting, correct?
I would imagine so, yeah.
Right, because that's the way this works. And given your chronic asthma, do you think that that would be a problem for you in getting additional coverage?
I mean, personally, I work out every day. I live a very healthy life, so I don't. But on paper, that's a different story.
You have to fill out the same questionnaire.
Like you're talking to me.
Yes, and Ms. Henriksen, you talked about your son's problem with the condition with a hole in his heart. When you fill out any application for underwriting purposes, you're required to go through your family's health history, and that would appear.
Yes.
And does that concern you?
Oh, completely.
Mr. Arnold, you were the one who concluded your compelling remarks with a smackdown to all of us about doing what's right. And you also have been affected by this because these are the types of things that make it frustrating for people to get private insurance because this can be so daunting. Is the experience that you've had consistent with what the other witnesses and some of the people we've been talking about face every day in trying to get health care coverage?
Absolutely so, yes. Yes. I won't repeat everything that they just said, but what Ms. Meister just said about being underwritten again and a pre-existing condition either not being covered or causing the base rate on that policy to be marked up by, my insurance agent told me, 20 to 100% because of that condition. These are the kinds of things that can happen.
Mr. Chairman, health insurance is supposed to help us when we're sick, not punish us for requiring medical care. And I think what we've heard today reinforces the need to get health reform done now. We as a country cannot afford to wait any longer. Passing meaningful health care legislation that eliminates disqualification based on pre-existing conditions is absolutely essential so that every American can have access to quality, comprehensive health insurance. And I yield back.
Thank you, Mr. Braley. I should note that Representative Hill is with us. He's a member of our committee. We had a hearing on rescissions down in his district earlier this year in Indiana. Like I said earlier, we're happy to go wherever we need to go do these hearings because I think it's important that we put a human face on the cost of health insurance. We have votes coming up. I'm going to try to get through this panel if we can. Mr. Green, you're up for questions, please.
Thank you, Mr. Chairman. I appreciate my colleague from Iowa's questions in your responses. I want to look at it from a different tack because if you have trouble with rate regulation or insurance regulation in California, in Texas we've never had any regulation. It is literally the free market. And having been involved as a state legislator in trying to deal with fairness for my constituents in purchasing individual policies and having a son who had the same problem in his small business trying to find an individual policy, he couldn't find one. One, because in high school he was diagnosed with colitis, and nobody wanted to write him except for $2,000 a month. He has found it through an HMO or PPO in the Rio Grande Valley in Texas, where he can get it, at least for his two boys now and his wife, because he just couldn't do it. So problems in the individual market and oversight, whether it's in California or Texas or Virginia or anywhere, and that's the issue. And that's why I want the lack of oversight or ability to look at what these premium increases that y'all are getting ready to experience. My concern, and this is something that that members of Congress have to defend when we travel anywhere, and believe me, it's made us watch where we're traveling. I want to ask some questions. In addition to paying their top executives handsomely between 2007 and 2008, WellPoint spent over $27 million to host 103 executive retreats off company premises. The Democrat caucus this year actually had our retreat here at the Capitol. 55 of these retreats, over half the costs were over $100,000. To put that in perspective, the median income in the United States in 2008 was $52,000. And so you can see that over half the retreats were over $100,000, so that was well over the median income. In 2007, WellPoint spent $3.7 million to host 782 attendees at a broker and agents event at the Phoenician, a lavish resort and spa in Arizona, for 5 days. And I'd like to put a picture up of that slide. Later that year, WellPoint sent 154 attendees to the Four Seasons Resort in Manly Bay, Hawaii, for a 4-day broker event that cost the company $850,000. That's over $5,000 a person, if we could put that slide there. In 2008, during the height of the recession, WellPoint paid over $1.3 million to host 360 attendees at the Four Seasons Hotel in San Diego. And if we could put that slide up there. Ms. Henriksen, do you think the company that is struggling to keep up with the rising health care costs would be able to send thousands of employees and agents on lavish retreats such as these?
No, definitely not. I'd like to know what they're doing at these retreats.
Mr. Arnold?
Of course not.
Ms. Meister?
No.
What is your reaction to the images and figures? Because I know what my constituents be if I was at those locations. And since you're ultimately paying the freight or asking to paying the freight, did it make you wonder if your hard-earned premiums have indirectly gone to paying for the spa retreats and the golf getaways?
I was thinking I wish I was an executive at WellPoint.
Mr. Chairman, it seems unconscionable to me that a company with the spending record that would reach deeper into the pockets of the policyholders at a time when so many Americans are struggling to stay afloat. It also seems to me that any company that can afford to send hundreds of their employees to these lavish retreats all over the world can afford to maintain reasonable and affordable premium rates for its customers. And that's what bothers me. On the individual market, we don't see that regulation and oversight on the state level. And that's why maybe on the national level, I know the President Obama earlier this week announced that there are parts of his bill that I have problems with, or his suggestion. But one of the things I like is if we're going to sell insurance across state lines to individuals, whether they be in Houston, Texas, where I represent, or San Diego or anywhere else, I would like to see that there is some oversight on what they're doing with that money to justify those premium increases. And thank you, Mr. Chairman.
Thank you, Mr. Green. Continuing with questions, Ms. Sutton from Ohio. Questions, please, for this panel.
Thank you, Mr. Chairman, and thank you for your compelling testimony. I think that your stories speak to the stories of many Americans across the country, including my constituents. To follow up on my colleague, Mr. Green's questioning, I'd just like to talk a little bit about the executives at WellPoint. Not only do we see the lavish retreats that were pictures that were reflected on the screen, we also know that as premium rates increase and become more and more inflated and health insurance coverage slips further out of reach for people just like you, it's important to ask, where are the revenues going? Not only to retreats, but also to executive salaries. WellPoint has stated publicly that these most recent premium increases were necessitated by rising medical costs and a shrinking risk pool. that it needs these rate increases in order to stay afloat. But I understand that companies do need to turn a profit. We all understand that. But what I don't understand is how WellPoint can claim that these increases, rate hikes that are literally bankrupting its policyholders, are necessary to stay in business, especially when we see what we see. When it is spending millions upon millions of dollars compensating its top executives. Data received by the committee show that WellPoint paid its executives over $347 million in 2007 and 2008 alone. In 2008, WellPoint paid $115 million to 85 senior executives, compensating 39 executives over $1 million each. That year, one executive made $9 million and two executives made over $4 million. And I guess I'd just like to ask you, our witnesses and policyholders, how you feel about a portion of your premium payments bankrolling multi-million-dollar salaries in these tough times. Mr. Meister, or Ms. Meister, do you believe a company that can afford to pay a single executive nearly $10 million in 1 year has the right to demand higher premiums from you so that it can, quote, keep up with the market?
No, I don't, and I agree with something Ms. Henriksen said. She said, if I raised my rates like they raised our rates, I wouldn't have clients, and that's the same in my business. You know, there's reasonable, and then there's just outrageous.
Thank you, Ms. Henriksen.
Well, not to be funny, but it makes me sick to think that all of this money is going to executives in this economy when so many people are struggling. And, you know, I do make good money, yet my industry is really struggling. There are no new hotels being built. There are no, you know, residential, there's no building going on. So I suffer because of that.
And Mr. Arnold?
I, of course, too, think it's unconscionable, and I believe the number I read was that in the last quarter, WellPoint had a profit of over $4 billion. Even if you cut that in half, it's still an incredibly healthy profit. So it just speaks to, as I said in my testimony, profiteering versus profit-making. There is a difference, and profit-making is fine. It drives our economy. It's the foundation of American business. But profiteering, when it affects people like us in the way that it has, is just wrong. It speaks to a lack of decency. And decency may not be, lack of decency may not be illegal, but it's wrong, and that's why I think it requires government intervention and regulation.
Thank you. I think you all make the case very well, and I, for one, don't think a company that's paying its executives more than $100 million a year has any right asking Americans to subsidize these outrageous salaries in the form of increased premium and stripped down coverage. It's not like you're getting more for what you're paying. Thanks.
Yield back. The gentle ladies yield back. We have 3 votes on the floor, and the first vote is the rule to allow debate to begin on the antitrust exemption if we're going to take it away from the insurance industry. So it's a rather critical vote, and thus far it's on basically party lines. So I'm going to recess for, hopefully we're back here in 20, 25 minutes. And I'd like this panel to stay if they can. I would love you to stay because you have Ms. Schakowsky, and I know Mr. Hill, Ms. Capps, and Ms. Eshu all probably had questions too. It's been a good panel. We'd like you to stay. So let's try to be back here in about 20, 25, let's call it 25 minutes. This vote might stay open for a little bit. 25 minutes. So we're in recess till 12:25.
Well, we voted for him. You know, my dog has.
Invite you back for every hearing.
Oh, great. Can you pay me too, please?
Thank you so much for coming in today.
Thank you
I love
for
your comments.
And
Thank
we
you.
really appreciate your thoughtfulness.
I think they'll give us lunch. I feel like my stomach is going to just start growling in a